non-steroidals and some newer drugs that we've got out there. I'm going to pass over to Matt now, who can introduce himself.
Hi, it's great to be here. Brilliant to chat to all of you CAM followers. I'm Matt. I am a Liverpool-trained anaesthetist. So I started life as a vet in practice. Then I did my specialist qualification in anaesthesia and pain management. And then I just got really interested in pain management, acute pain, so kind of surgical pain, and then chronic pain, what we're all talking about tonight, arthritis. And I've worked in specialist hospitals for over the past 10 years. I can't even remember how long. I now work at Anderson Moore's Vet Specialists, which is a specialist referral hospital in Hampshire. And I'm the co-founder of a website called Zero Pain Philosophy, which provides education and resources for vets and vet nurses.
Brilliant. So as you can tell by that amazing introduction, we've got a real expert here who's going to teach us a lot of things about non-steroidals today. So we'll just go straight into it. Can you tell me a little bit about what a non-steroidal actually is?
Yeah, I guess I was thinking about this today at work. Where do I start? So when we're talking about non-steroidals, we're talking about drugs like Metacam. I'm sure Metacam is the market leader in the UK. That's the trade name. The generic name is Meloxicam. Your dogs may be receiving different brands of Meloxicam. So that's one example. We've got drugs like Rimadyl, Simalgex, Onsior. So I think off the top of my head, there are about 7 common non-steroidals that we use in dogs. And why do we use non-steroidals? I guess these, for me, are first-line drugs in treating arthritis. I think one thing to point out that's really important is what influences your vet's decision-making process. Okay, what I want is a drug that works, but secondly, I want a drug that's safe. So when I prescribe a drug and I say to you in my pain clinic, I say, well, this is the drug I want you to take. I want you to go home and give Buster this drug every day for however long. I want it to work, and I don't want your dog to have any side effects associated with that.
Yeah.
How do we know whether these drugs are safe and effective? They go through the licensing process. So all of those 7 non-steroidals are licensed for long-term use in dogs for treating conditions such as osteoarthritis. And actually the license of most of those is specifically for osteoarthritis as opposed to any other type of pain, chronic pain, because osteoarthritis is the biggest cause of chronic pain in dogs. That is why non-steroidals are our first line, because they're licensed, and we are required under what's called the cascade, according to the Veterinary Medicines Directorate, who regulate our prescribing. We are required to use licensed products as our first line products. So you might think, well, my dog's on this, my dog's on gabapentin, my dog's on all of these other drugs. You've heard Claire Rusbridge in the last week, you heard Gwen last night, talking about lots of other drugs. You think, well, why is my dog not on that? Why did my vet start with X drug to start with? It's because these are licensed drugs. And we know that they're safe and they're effective because they've gone through trials to tell us and give us that information. A lot of the other drugs that we could talk about, you've heard about, things like gabapentin, they're not licensed, and we don't have a huge amount of information. Although we use them a lot, we use them off license. So that's really the reason why we're going to use non-steroidals first. Yes. I think the other drug we're going to talk about tonight, galliprant, its generic name is grapiprant. That drug does also have a canine license as well for management of osteoarthritis. So really, these are our 2 first-line drugs as far as osteoarthritis goes.
Yeah, brilliant. So when I think an easy way to start this would be to sort of talk about, because I know we talked about the licensing, but actually when we're talking about arthritis, they're the first line because of their anti-inflammatory effect. So maybe you could go into a little bit more detail for us.
Yeah, so when we have chronic pain, when we have pain full stop, whether it's acute pain, so pain caused by, let's say, a dog being hit by a car, or a dog undergoing surgery, or a dog with arthritis, the root cause of that pain is inflammation. And in arthritis, obviously, that's inflammation in the joint. If the dog's hit by a car and sustains a fracture, then it's pain associated with the tissue damage. So this is the big thing with inflammation is tissue damage. So I think everyone's fairly intelligent on here. I'm not going to go too sciencey. If you imagine a cell, all of our body's made up of totally different types of cells. If we're talking about the joints, we're talking about cartilage cells, bone cells, and synovial cells, which are the capsule of the joint. So we've got lots of cells. When we have damage to any cell, we get release of the cell membrane. And there are enzymes. The main ones that we know about are the cyclooxygenase enzymes. They work to break down the cell membrane to produce.
Oh, I think we've just lost Matt. Bear with us just 2 minutes while he comes back. It's probably a connectivity problem. We've been having a lot of issues with everybody being online at the same time. While we're waiting for him to come back, I thought I'll go through some of these comments and see who's here. So hi Fran, hi Lynn, hi Rosemary, hi Julia. That's all right. Back, here he is.
Hello. I don't know what happened then.
Don't worry. So you were just talking about the cyclooxygenases.
Yeah, so where we have damage to the cell membrane in arthritis, that causes inflammation in the joint. And where our non-steroidals work is they work on those cyclooxygenase enzymes to prevent the production of those inflammatory mediators. So inflammatory mediators, what they do is they activate the nerves in the joint, and the nerves then send a signal up to the brain to say, ouch, it hurts. Yeah. So fairly simple, but really where we have uncontrolled inflammation, the consequences can be devastating, as you will all appreciate with your arthritic dogs.
Yes. So then the non-steroidals come in to try and break that cycle.
Yeah, so the main way that the non-steroidals work is they inhibit cyclooxygenase as an enzyme with the aim of reducing the production of those inflammatory mediators. That's why we're really keen to use these drugs early on in the process. So that's what we would call dealing with the peripheral sensitization. So sensitization is quite a good word because it describes what's going on. The joint is really sensitive, and I'm sure some of you will suffer with arthritis as well, and you know that that particular joint that's affected, the area of the body, is sensitive. That's why we say sensitization, because the inflammatory mediators are acting on those nerves to irritate the nerves, if you like, and increase the conduction of that signal from the joint up to the brain. So all of the brain hears is ouch, it hurts, ouch, it hurts, ouch, it hurts. When that carries on for quite a long time, don't know exactly when that peripheral sensitization gets worse, if you like, we can get inflammation at the level of the spinal cord as well. So the spinal cord is like the first relay from, let's say, my elbow joint. The signal's then going up to my spinal cord and then ascending up to my brain, where we say pain is a conscious perception. So my brain is saying, ouch, that hurts. Yeah. That's having the effect of me taking the weight off my elbow and feeling bad about my elbow pain, thinking, well, actually, I don't want to do the things that I normally do because my elbow hurts.
And that's that element of suffering there, isn't it? The emotion.
Yeah. Yeah, absolutely. So it's not just that A to B, there's inflammation in the joint and we're going to pull away or we're going to stop using that joint. We have what we call the affective component, which is where the suffering of pain comes in. It's how the pain makes the patient feel. And again, you'll appreciate that on a day-to-day basis. Yeah. I know one of the things a lot of people say is, my dog changes according to the weather. So the weather can make their arthritis feel worse. If they know that they're going to go out and they're going to get cold, they're not going to want to go out for a walk. That's the affective component. That's the arthritis affecting how your pet feels on a day-to-day basis and affecting their normal behaviours.
Yeah, absolutely. So we talked about the cyclooxygenases and their process and inflammation, but I wonder if you could go into a bit more detail about where else they are and why we get the side effects that some dogs see with non-steroidals.
Yeah, so one of the inflammatory mediators that the cyclooxygenases produce is called prostaglandin. And, okay, there's always yin and yang in the body, isn't there? There's a good bit and there's a bad bit. And prostaglandins, as far as inflammation go, are bad, but prostaglandins, as far as things like maintaining blood flow to our stomach lining and our gut lining, are really important. And they also regulate blood flow to our kidneys as well. And with any drug, where I said about safety and efficacy, so there's a balance between the drug being effective and the drug being safe, and that balance is those side effects.
Yeah.
So the side effects that we see with non-steroidals are related to the fact that we knock out the prostaglandins that we want to keep, which is really hard. So we can affect blood flow to the lining of the stomach, which is why these drugs may cause vomiting as an adverse effect, or it may affect blood flow to the intestines, which is why we see diarrhea as a side effect of these drugs. And in extreme cases, mostly related to overdose, is why we see a problem associated with the kidney.
Yeah.
Now, that's one of the main reasons why we should never use ibuprofen in dogs, because ibuprofen is a non-steroidal. It's the same class of drug as Metacam, Carprofen, Rimadyl, Onsior, Robenacoxib, all these drugs, same category. Ibuprofen is really toxic to dogs, so it's a really important one to point out that you can't just give your dog ibuprofen.
Yeah, and we're lucky in this category, in the non-steroidal category, because it's the one category we've got a lot of options for dogs. And do you mind going through some of the options? Because I think a lot of vets will have their favourite for various reasons. Can you talk about a little bit about the range of drugs that we've got out there in terms of sort of why there's different ones and the formulations they come in?
Yeah. Do you know what? I think the most important thing, the word we use is compliance. Yeah. The most important thing for me is if I prescribe a drug, I want the owner to be able to give it to their pet, and I want the pet to be able to take it. Because there's no point. I mean, I've had it with my own cat. He is very difficult to medicate. And you know that your pet's going to benefit from medication, but you just can't get into them. So options we have, all versions of meloxicam, so Metacam, Meloxidil, Meloxaid, they're all a liquid, which really easy to give that drug, and really easy, if we want to adjust the dose, we can do that really easily because it's a liquid. Yeah. Other options, okay, some dogs don't like liquid, they're suspicious of things in their food. Some like what's called a palatable tablet, so tablets that are flavoured with either chicken or beef. Onsior is one of those, Robenacoxib, and the Rimadyl tablets, Rimadyl palatable tablets. I don't know if those of you will remember the old style Rimadyl when it first came out. They're just like a normal white pill. Some of the generic versions are just the normal white pills. Rimadyl palatable is a palatable tablet that hopefully your pet will just eat. Okay, that has its problems because when they realise they like those tablets, they want to find them. So again, it's really important that you store your medications out of reach of children and pets. Yeah. We do have a whole range of drugs available. So the other thing, when we think about formulation, the other thing is frequency of dosing. So we could have some great drugs, but if I ask you to give a drug 4 times a day, can you actually do that? Mm-hmm. So something like meloxicam, it's dosed once a day. You can almost see why it has such a share of the market, because it's dosed once a day and it's a liquid. It's just so easy to do. Something like Onsior, it's a palatable tablet. Again, it's once a day. So we've got to think about these things. These things do play a massive role. Yeah. And believe it or not, drugs companies spend a lot of thought, effort and money in market research, talking to clients, saying, how often can you give your patient, your pet a pill? Do you want a pill? Do you want a liquid? So you don't kind of realise this when you prescribe the drug off the shelf, but there is a heck of a lot of work that goes into all of these factors to improve what we call compliance.
I think it's so important. I've got to be honest, as an owner, I'm the worst. I'm terrible at remembering when to give tablets, and I've got a similar sort of cohort as you in that a lot of my patients are arthritic pets, so and I do acupuncture. So I'm asking owners to give 3 times a day drugs. But if you ask me to do it, I'd find that really tough. Yeah. So I've got a lot of respect for owners who've got huge number of drugs and lots of variations. So I think it's really important to have a drug that's easy to give as part of your pet's sort of lifestyle.
Yes. I think that's really important. I mean, the other thing that I was going to add there when I said there are 7 non-steroidals, some of you are probably thinking, oh, my dog's on this, and you've mentioned another one. Why is my dog not on that?
Yeah.
And why do people have preferences? There is no evidence that one of those non-steroidals is any better than another, but different non-steroidals suit different pets.
Yeah.
So some dogs respond really well to one and they don't respond to another. Some dogs have adverse effects with one and they don't have adverse effects with another. So if I prescribe a dog X drug and it causes vomiting, then I'm going to stop it. I'm going to do what's called a washout period, anything from 3 to 5 days. Literature is really vague on that. Our practices all vary.
Yeah.
And then I'm going to try another one, because I've spent a lot of time in the past going around the houses with loads of different drugs, when what I should have done in the first place was switch the non-steroidal to start with.
Yeah.
So there are lots of drugs in that class. There are lots of options available. If one drug doesn't suit your pet, you need to tell your vet. And the next thing I would recommend would be switching to another class of another non-steroidal. Yeah.
Yeah. I think it'd be interesting to have a little bit of a chat about the most common side effects that you see with steroidals, if that's okay.
Yeah. So vomiting and diarrhea are the 2 side effects that we're always going to, if we haven't written it on the label of the drug when we dispense it, we will always have discussed that with you. If you see any vomiting or diarrhea, then you should stop that medication. Yeah. And maybe even think a little bit more subtly than that as well. These signs don't always happen when we first start the drug, and they could happen a little bit further down the line. But generally, I find if a dog has tolerated a non-steroidal for 3 to 4 weeks, then they're probably going to be okay. I think that's quite a kind of good, sensible rationale to live by. But I would always say to owners that a recheck visit, and this is why it's so important to go to your recheck visits. We dispense drugs and they work, but it's so important that we keep a handle on what's going on with your pet. I always say the absolute worst thing that could happen when I prescribe a non-steroidal is I'm consulting and I just see the client at the desk there just collecting a repeat prescription every single month for 6 months. We have to see you every 6 months to carry on prescribing. But the absolute worst thing that can happen for an arthritic dog is for us to prescribe a non-steroidal and then you not to talk to your vet for another 6 months. Absolute worst thing. We know that 50% of dogs diagnosed with arthritis are diagnosed too late. Yeah. What we really need a much better handle on, we really need owners to help us with this, is when do we add something else to that non-steroidal? When does that pet need something else? And we can't, if you don't come back within 6 months, we absolutely cannot help your pet. So really, really important there. I can't remember how we got there.
I think that's quite an important point, really. A common mistake I see, it's not, thankfully not too common, but what will happen is that we've prescribed a medication such as, let's say, metacam, pulling one out of the air, and then the owners notice that the dog's deteriorated, and then the mistake that they make is trying to give them more of the dose than they should have, or increase the number of doses, and they are really drugs that you can't do that with. You have to speak to your vet, and that's side effects happen when the dose is too high, or you can risk all sorts of horrible things happening. So I think that's absolutely right, getting that recheck in and speaking to your vet if you feel it's not working, or you saw a great improvement initially and then it's deteriorated. That's definitely the point to sort of continue that communication.
You were asking me about side effects, weren't you? I think we see vomiting and diarrhea. We see vomiting and we can see diarrhea in dogs that are on non-steroidals for other reasons. So maybe they've scavenged. If you do see signs of vomiting or diarrhea, we should stop the non-steroidal. And okay, in a dog with arthritis, that is not the best thing to do, but during that period we're going to have to rest. You're going to have to accept that your dog can't do as much as they normally can do, and it's really important that we do treat that vomiting, diarrhea. Worst thing that happens is that sickness and diarrhea turns into something more serious. So okay, we prescribe a lot of these drugs on a day-to-day basis, but we are very well aware of the side effects, and that's why we want to monitor your pets really closely.
Yeah, absolutely. And I think this kind of leads me on. I think a lot of the questions we'll get at the end will sort of answer more questions to do with non-steroidals. So I think this kind of leads on to why why a drug like Galakrond has been designed and the benefits of that. Do you mind going into that?
No, that's great. So again, it kind of goes back to what do we want? You can tell I spend a lot of time talking to owners about this. I share my prescribing decisions with owners.
Yeah.
It's one of the things I want. It's really important that you are totally on board with what your vet is prescribing for you. If you think, he doesn't know what he's talking about, or a young vet, or he doesn't know anything, then you're not on board with giving that medication. You don't think it's going to work.
Yeah.
I'm looking at safety and I'm looking at efficacy. So what we want, we've talked about non-steroidals. They are really effective. They are safe, but we know the side effects. What we want is a drug that is effective as non-steroidals, but doesn't have those side effects of vomiting, diarrhea. So the company that developed grapiprant, what they did is they looked for a target for the drug, and this is much more of a modern way to do drug research, is to actually find out where on the pain pathway can we target to reduce inflammation. And what they did is they came across this subgroup of prostaglandin receptors. So remember, we said prostaglandins are responsible, they're one of those inflammatory mediators. So we're trying to take away the bad prostaglandins and preserve the good prostaglandins. Yeah. And they came across a group of receptors labeled EP1, 2, 3, 4. There are a few more. The EP4 receptor is a prostaglandin receptor that is specific for pain. So what the school of thought is, if you can take away the effect of this receptor, so reduce the prostaglandins that receptor produces, those are the ones responsible for pain. You leave the other prostaglandin receptors functional, those are the ones producing the good prostaglandins. Yeah. So think of galliprant, as a much more targeted, focused drug. So it's working further down the inflammatory, further down that cascade compared to the non-steroidals. Non-steroidals are working higher up. Those of you with a little bit of knowledge and maybe have had arthritic dogs for a number of years, your dog may have been prescribed steroids a long time ago. I'm talking over 20 years ago for management of arthritis. Steroids work much higher up that pathway. Then we have non-steroidals. Then galliprant is really specific, so working right at the bottom of that pathway on that specific EP4 receptor. The idea with galliprant is that we get the pain relief, so we get the anti-inflammatory effect that causes the pain relief, but we don't see the side effects associated that we see with non-steroidals. So this is like our holy grail, is to find a really effective drug that has no side effects. I'm trying to think of a drug that actually meets all of those criteria. There aren't many. All drugs have their kind of safety efficacy balance. That's the way to think about it. So yeah, grapiprant's more specific.
So let's talk about a dog who does get diarrhea when they're taking grapiprant or Galakrond. How would you need to respond in the same way as you would with other non-steroidals?
Yeah, so we know from one of the clinical trials that was conducted with Galliprant that you can see a softening of the stools with grapiprant, but what they know over time is that doesn't necessarily correlate with damage to the gastrointestinal mucosa. Yes. So you can see soft feces with grapiprant, but that doesn't necessarily mean it's causing an underlying problem. Okay, in some dogs that may be intolerable and that's the wrong drug and we're going to switch to something else. Yeah. If you see watery diarrhea or diarrhea with blood in it, then that's one of those examples where that drug is not a good option. But it is not unusual to see a softer feces with that drug.
Okay, and in terms of its effects, because it's lower down on the spectrum that you're talking about, do we worry as much about kidneys with giving grapiprant?
It's a really good question, and I think the honest answer is we don't actually know right now, because it would be a fairly nasty experiment to do, to give dogs big doses of grapiprant and look at what happens to their kidneys. Although in these studies, I'm just trying to think of the highest dose they used in the licensing studies. The dose that we use at the moment is 2 milligrams per kilogram. They definitely tested 6 milligrams per kilogram, and they did test higher than that as well, and they didn't see any adverse effects as far as the kidneys go at those higher doses. But I think take-home message is, as far as dosing goes, where does the dose come from? It comes from those dosing studies that look at, let's give 5 doses to a group of dogs and see which dose is the most effective. That's how the dose on the packet is established. Those studies aren't, yes, they're designed to capture some of the side effects, but these, I think it's really safe to say that no veterinary medicine is safe for you to go out and double the dose if you think, oh, he's having a bad day, I'm going to give X amount more, without veterinary direction in that regard. So I wouldn't, we haven't had grapiprant for long enough for me to say, oh, well, actually, yeah, you can use this much more on a bad day. So,
because I believe it's been in the UK for about 2 years now, hasn't it? And I think in America for 4 or 5, I think.
Yeah, we were talking about it back in 2017. I think it had already launched in the States, and I think we got it early 2018 maybe. Yeah. But compared to things like non-steroidals, we've had non-steroidals for 20-30 years, so that's the difference in experience. And galliprant is a totally new class of molecules, the class called the pitprants, and those drugs aren't used in human medicine either. So we take a lot of what we know from human medicine, and the pitprants aren't used in human medicine either. So
it's quite exciting to have something in vet med that isn't already in humans.
Yeah, it's pretty cool.
It's cool. So I just wanted to talk a little bit about the licensing with Galakrond, because at the moment it's licensed just for mild to moderate arthritis. Would you use it in cases of more severe arthritis, or would you switch purely to, depending on
Yeah, so the license comes from the what they call the field trial, was 282 dogs. This is part of the licensing process, where they took 282 dogs that had osteoarthritis, and they prescribed them with the 2 mg per kg once a day dose that we know works. When they enrolled those dogs, they underwent a scoring system called a total orthopedic score, where the vet examined them. If they had X-ray, I can't remember whether I think they all did have X-rays taken, and they classified their arthritis. Now, the dogs in those groups were only classified as mild to moderate, so none of the dogs recruited had severe arthritis, which is why if you were part of a 10-people panel on the European Medicines Agency saying, do we grant this drug a license, does it work in severe arthritis, you can't put your name to that and say this drug works in severe arthritis. That's why it says it's mild to moderate in the licensing. Yeah. But if I've gone around the houses with non-steroidals, if I've got a dog with severe arthritis, and I can work those out, because I would use a scoring system called the COAST scoring system. So this is a really useful pain scoring system. So we would ask you to complete a pain score. It doesn't matter what the pain scale is. I really like the Canine Brief Pain Inventory. It's 10 questions. It's really easy to do. We would score your dog as having either mild, moderate, or severe arthritis. If I'm diagnosing your dog with severe arthritis, I'm going to prescribe you a non-steroidal, and I'm probably going to prescribe you with something else right from day one. If we find out that we try another non-steroidal, and maybe we try a third non-steroidal, it doesn't make a difference, then at that stage I would think about trying grapiprant, galliprant, and seeing if there is a difference with that.
Yeah, I think that the problem is with severe arthritis is you can't do a study effectively on that, because each case is going to be so different. Creating a study to see whether that would be effective or not would just be impossible to do. So but in the case of severe arthritis anyway, we end up having to go off license to some extent in order to manage pain, because we may need to add in a drug like gabapentin or long-term paracetamol, or whatever it may be. So absolutely.
And I think, just quickly to jump in before we move on, we talked about non-steroidals and grapiprant. We can't use those drugs together. So some people will be thinking, well, my dog's on Metacam, can he have grapiprant as well? The answer is no, because they work in a very similar way. And we don't honestly know, if we add those effects together, are we going to get a brilliant effect, or are we going to cause a massive problem? No vet wants to try that on a client-owned dog, so let's not do that. I have seen cases referred that have been prescribed both, but I think that's out of people not being aware when the drug was first launched that we shouldn't do it. So yeah, I wouldn't do it.
Safe to do. And that's actually interesting. So what other drugs would you say you can't use with a non-steroidal and you can't use with Galliprant in general terms?
It would be steroids. So really, we know that if we use steroids and non-steroidals together, we double our risk of getting stomach ulcers.
Yeah.
With galliprant, grapiprant, again, I've said they work on the same pathway. So the license indication, it says on the label, don't use those drugs alongside steroids. So,
yeah. Brilliant. And in general, it's good to know as a vet what we can and can't use together, because we're always worried about the side effects and the future consequences of doing that. So I think if anybody's out there and wondering why their vet hasn't added in one of these drugs, it may be because of this reason.
Yeah.
Just to highlight that. So I think we've gone through a few, or I have a few notes here of things we wanted to talk about. I think we've kind of gone through most of those things. Is there anything you wanted to go through in more detail?
One of the questions I put in there was when we wouldn't use grapiprant.
Yes.
I can't think of many reasons when we wouldn't, but we still have a degree of uncertainty over is if we have a dog with arthritis, whether it's mild, moderate or severe, should we use a non-steroidal first or should we use grapiprant? Yeah. I think what we would all love, as I say, is a drug that is more effective than a non-steroidal.
Yeah.
We know that grapiprant is probably as effective as a non-steroidal. So I can't honestly say to you, you should start this dog on grapiprant first or you should start this dog on meloxicam first. So it really is, a lot of it's down to our experience.
Yeah.
And if you go and see 10 vets, they may prescribe a different non-steroidal as a first line. And that is based on their experience. I think we have to give a lot of consideration to the vet's experience.
Yeah.
What I think is really important is that we give these drugs enough time to work. So on some of the labels of some of the drugs, they may say if it doesn't work after 7 days, then discontinue it.
Yeah.
My rationale for saying longer is based on some human work that shows it can take up to 6 weeks to see full effect of certain drugs in certain disease states like arthritis.
Yeah.
Let's remember that not every arthritic dog is exactly the same as the next one. We do need to give these drugs time to work. One of my final points is going to be we need to consider absolutely everything, and drugs are not the be-all and end-all. Yeah. What I'm going to do for a fresh case of arthritis, I'm going to prescribe you a non-steroidal, and I'm going to send you off and say you need to do that for a month, and then you're going to report back to me. At some point in that month, we might talk about that in our first consultation, but we might have a chat 2 weeks later and say, right, okay, these are all the other things you need to be doing. It takes you up to a month to start instituting all of those other things, and everything is as important as the next thing. So drugs are as important as physio and exercise management. Absolutely. So we do need to give the drugs a chance, but we need to give everything else a chance as well.
Yeah, I think just going back to your point about the vet's confidence with something, I think one of the phrases that we say as vets is the safest protocol to use is the one you know the best.
Yeah.
And, that's often the case, is that we are nervous to use new drugs because we may have given 100 meloxicam before. If we've never given Galliprant before, we don't know what the effects are going to be, and we'll find it harder from a personal point of view to recommend it if we don't know. So yeah, I think it's working with your vet if you do want to try a different tack, being aware of why they may or may not want to try one of the drugs that you've heard about that you think's going to work. You never know.
Yeah, familiarity is absolutely best. And we've all had our own personal bad experiences with certain things, and you would never wish that on a client's dog. So yeah,
we all learn from those things.
Yeah.
Cool. I think the other thing I was just going to mention about Galliprant, which is different to most non-steroidals, is that it is supposed to be given without food. because that's one of the things that comes up on Holly's Army or not. So it's a once-a-day drug, and it is without food. I believe, you'll be able to correct me if I'm wrong, I believe it's liver that they've flavoured it with, potentially. But it's flavoured anyway. And so it should be a tasty tablet, and most dogs think it's a great treat and they'll just eat it. So I like it from an ease point of view. But the only thing to be aware of is you do need to time it right. So to give yourself sort of 45 minutes to an hour before they eat to make sure it's absorbed properly.
Yeah, and I think one of the questions I always get asked, that is correct. One of the things is, do I give my non-steroidal or my grapiprant in the morning, or do I give it in the evening?
Yeah.
When we're thinking about drugs that are dosed once daily, what we're doing is when we start that course of drug, we obviously give them orally, they're absorbed into the bloodstream. Our aim is to achieve what we call a steady state plasma concentration after a period of time. If we remember to give that drug once a day, it shouldn't really matter if we give it in the morning or in the evening, as long as we give it the same time every day.
Yeah.
I think that's really the important thing. If you normally give a drug in the morning and you forget and you don't give it until the evening, then you may well find that there's the effective levels or the plasma levels, so the level in the blood. But actually what's most important is the level actually at the level of the level of drug at the site of the pain, so what we call the tissue effect site. So that level may be dropping, and you may notice your pet becoming more painful if you've missed a day or a day and a half or 2 days.
Yeah.
But really, if the medication is once daily, then it should be adequate just to give that drug once a day, and it probably doesn't matter whether you give it morning or evening.
Fine. I just want to say, just before we carry on, I've noticed that Hannah just made a comment, and I just want to reiterate it, that neither of us are sponsored by any of the drugs we've mentioned. It's a totally free, voluntary talk. The reason we've decided to talk about these particular drugs is just because in Holly's Army, which if you're not a member of the group, it's definitely worth being part of. It's an owner support group for people with arthritic dogs. And one of the very common questions that comes up is, many questions that come up are ones about non-steroidal drugs and how to give them and what they do, and also about this newer drug Galakrond. So we wanted to get Matt on here because he's brilliant and very knowledgeable, but just to give you guys a bit more information from evidence-based medicine, really, just so that everybody's aware of why we're doing this talk today.
Yeah. You should have had our conflicts of interest statement at the start, shouldn't we?
Yes, I didn't get involved, but I just wanted to make sure everyone was aware of that. Should we go through some of the questions?
Sure.
Let's have a little read through. I'll go back a little way. So let's have a look. Somebody's asked if the cascade for prescriptions is something that non-veterinary staff can have access to.
Where's the best place to read about the cascade? You can read about it on the Veterinary Medicines Directorate website. I'm not quite sure whether the BSAVA website, the British Small Animal Veterinary Association, whether there's anything on there for owners about the cascade. What do you need to know about the cascade? The first thing that we're going to do is use a drug that's licensed for that condition. So dog with arthritis, I'm going to use one of the non-steroidals that's licensed for that condition. If I then need to add something else in, that's when it becomes a bit difficult, because none of these drugs are licensed to be used in combination. We don't have any drugs licensed to use in combination. Yeah. So another drug that's licensed for arthritis is Traleve, which is Tramadol. It is licensed, but as far as efficacy goes with Tramadol, the evidence isn't as good as non-steroidal. So I know some of you your dogs will be taking Tramadol, and some of you will have different experiences with Tramadol. It does have a license for pain relief in dogs, but it's not licensed to use with non-steroidal. So once we get away from monotherapy, we're really kind of pushing the cascade anyway.
Yeah.
Once we get beyond those drugs, then we're using human medications that we either know about from the scientific literature are effective or based on our own experience. So one drug that you may have listened to Duncan Lascelles recently, he did a study looking at Amantadine. Amantadine tends to be one of my number 2 choices based on that work that he did and based on my experience with using that drug. So that would be an example where I'm using the cascade, I'm prescribing off license. It's a very well recognised route of prescribing where we don't have any veterinary license options. We go to using human drugs.
Yeah, and it may be that it's licensed in some cases, not specifically for this group of drugs we're talking about, but there are instances where vets may use a drug that is licensed for another disease, but we use it for a particular condition because we've got knowledge within the veterinary community that it's effective for that, but there's not been the license done for it. So there's various reasons why we may choose to use something slightly off license or cascade. That's something you can always talk to your vet about, because where it's hammered into us from day one what we're allowed and all those sorts of things. Let's have a look. So Sonia said, can we as owners request what type of pain relief, non-steroidal, Galakrond, or is it totally vet directed?
I think it's a really good question. I think the most important thing here is to build a relationship with your vet and they need an understanding of what you're trying to achieve and you need an understanding of what they're trying to achieve. I guess, like we said before, we will make our first prescribing decisions based on our experience. And I could totally understand if 60% of people here went to a vet now, and those vets will all have better experience with non-steroidals than they will do with galliprant. Yeah. So that will totally influence prescribing of galliprant right now. Although, like I said, I would always try non-steroidals as a first line right now. But if non-steroidals don't suit that pet, then galliprant is definitely an option. Yeah. I mean, any prescribing decision is to be made by the vet, but that's the science of veterinary practice. The art of veterinary practice is working with pet owners, because, like I say, if you're not on board with the decision your vet's going to make, you're not going to be on board with giving that treatment and telling the vet that it actually works.
But at the end of the day, you're the one that has to give the treatment, aren't you? So it is important to have a good relationship with your vet.
Yeah, definitely.
I think most vets are very open to conversation and ideas.
I think arthritis management is one of those things that in the past, so even up to the last 5 years, I would say arthritis management has focused on non-steroidals. Dog goes to the vet, gets a pill that makes the dog better. You all know how much there is to do with osteoarthritis management, and Cam has done an amazing job in educating owners that it's not just about drug management. I don't honestly think you can effectively treat arthritis by seeing your vet every 6 months and getting a repeat prescription that you dispense online from an online pharmacy. An online pharmacy cannot replace the service that you get from your vet practice. And one thing that I'm really passionate about is that we should have more nurse arthritis-led clinics. And exactly the same. If I walk around the corner and go and see my doctor now, and I don't have diabetes, just an example. If I go to a diabetes clinic, for example, that would be a nurse-led clinic. We should be driving nurse-led clinics in the management of arthritis. And you should be seeing the nurse on a regular basis with your pet to deal with all of the other things. Okay, nurses can't make prescribing decisions, but they can influence the vet and talk to the vet about prescribing decisions.
Absolutely. Kira, I try and get her comment short, is obviously a vet paraprofessional. She said she has a client who chooses not to give pain meds because they worry about long-term issues. Meanwhile, the pet suffers short-term. What can we say to those owners to get them on board? And I'd argue the pet's probably suffering long-term as well as short-term in this instance.
Yeah, I talked to your vet about it. I think that the adverse effects we've outlined with non-steroidals do not happen in every single pet. They may have happened to pets owned by people on this call right now, but when you look at the actual incidence, so the number of pets prescribed non-steroidals versus the adverse effects, the numbers are absolutely tiny. So from a benefit, if you look at kind of the cost-benefit ratio, the benefit of giving non-steroidals vastly outweighs the risk of the side effects. So the thing I say to all owners is this is what I would do in my own pet. After that, I can't say anything more. It is your decision to make. But what is really important to prevent that pet suffering, again, work with your vet. If you're not comfortable with that drug, then there are other options. But honestly, none of those options are as effective as a non-steroidal. So I firmly believe of all the drugs we have available, non-steroidals are the most effective drugs for managing arthritis, and we should always start with non-steroidals. But there are other options, and if you're really worried about the drugs, then you have to be doing absolutely everything else: the physiotherapy, the weight management, the hydrotherapy, the diet, absolutely everything. You can't throw the drugs out and then not do all of the other bits. So we're all in this for the hard yards.
Yeah, absolutely. And there's a lot of questions that are coming up regarding Cartrophen. Do you mind just talking about that?
Yeah, Cartrophen's a difficult one. It's something that I used to use when I was I haven't used it for over 15 years. 15 years was the last time I was in practice. I used to use Cartrophen, and I had some fairly good results. Some owners that were very happy with using it. They thought it made a difference to their pet. I can't remember the current. I think this is still current. They always used to say when you gave the Cartrophen injection, you should stop the non-steroidals for a few days. And actually, that's probably the worst thing that you can do in an arthritic dog is deprive them of non-steroidals. Yeah. When you look on the Cartrophen website, the evidence looks pretty good. But I just think as a kind of pain community, and vets that treat pain probably aren't terribly impressed with Cartrophen. If it's something that is used in your pet and you think it makes a difference, this is the thing I always say to owners, is if you think it makes a difference, then carry on with it. But if we were in a case of severe arthritis, I don't honestly think it's going to make any difference. Yeah. If you have a case of very mild arthritis, then it may make a difference.
Yeah. And I don't know how much you know about this, but a common question that comes up is talking about whether you can or can't use it with non-steroidals. My issue is that it's very convoluted, the advice out there, even on the Cartrophen website. I think I quoted it to one of our followers the other day, and it sort of says there shouldn't be any side effects, but there might be. And it's a bit tricky. So I think most vets won't, but there are some who use it very regularly and are more comfortable with it. And again, that comes down to experience and preference, doesn't it?
I think that maybe it speaks volumes that I haven't used it for the past 15 years, and I think I have enough options for managing arthritis. Yeah. So,
I've got a question here from Karen. She says she took Galakrond with paracetamol. Her vet prescribed Pardel V, and the dog gets diarrhea, but is okay on over-the-counter paracetamol. What's in Pardel that's making her suffer with watery diarrhea?
Pardel also has codeine in it, but the codeine is only 4% bioavailable. So when we give the codeine orally, only 4% of that actually gets into the bloodstream. If you or I take codeine, we will get constipation. Why it causes diarrhea in dogs, I don't know. But when we use opioids, so methadone is a common opioid we use in dogs, that can cause certainly soft feces. So I don't think dogs' guts behave the same as ours do with opioids. It could be the codeine. It could just be the tablet formulation. To be honest, the other bit, you've got to have some other chemicals that make up the tablet. It could be that. I would always, if I'm going to prescribe paracetamol, what I should do is I should prescribe Pardel because it's licensed, and according to the cascade, I have to prescribe that first. If I prescribe Pardel and your dog has diarrhea with it, then there's our rationale for going to using the over-the-counter preparation.
Yeah.
There is now a formulation of paracetamol tablet available from Summit Pharmaceuticals, which is a 200 milligram paracetamol, which from a dispensing point of view is really easy for us. So I'm probably using that more at the moment.
Yeah. Sam has asked for a bit of advice on her Daxi. She has a Daxi who's had 2 cases of IBDD, now has suspected hip arthritis in her hips. Metacam really helps. They notice improvement after a day or 2, so take his exercise right back down. How or when should we take him off? He was on for about 2 weeks last time.
Because of an exacerbation of hip
arthritis.
Arthritis is a long-term progressive disease, so this isn't really something where we're going to stop and start a medication. So what I think you need to look at, you need to talk to your vet and work out a long-term plan. Similarly with intervertebral disc disease, if dogs have had disc problems with 1, 2, they will, especially Daxies, they will have problems with subsequent discs. And I think I would look at a longer term plan for the future. I honestly think you need to think about all of those things to manage: exercise, diet, weight management, getting the painkillers right. I think if you've noticed a difference with your pet on painkillers for 2 weeks, then there's probably some evidence there that he or she needs longer term pain management.
Yeah, absolutely. The other thing you could do is we had a live with the amazing Claire Rusford last week, and we talked all the way through IVDD, so that might be a good thing to go and have a look at as well. But yeah, I would agree in that circumstance, it's probably a case of your dog's getting quite painful, so the pain is building up until can't cope anymore, and then you're noticing the signs, and then you put them on pain relief, so it reduces again for a little while, and then it's building up again. So it's definitely worth trying to get that nice, even constant analgesia for
I think the other thing to think about there is if you've got 2 sources of pain, you certainly will have a degree of sensitization from the intervertebral disc disease, and then you bring another type of pain along, and that second type of pain is going to be worse because of that pre-existing sensitization. Yeah. That's the essence of central sensitization. Yeah, those of you that suffer from arthritis yourselves will find that any other type of pain you experience is probably worse than it was before you had the arthritis.
Yeah. Gemma has asked an interesting question. In a chronic, moderate, severe case, what would be your choice of analgesic if cost is a huge factor? Would you treat for inflammatory pain or neuropathic pain first? Home adaptations, exercise, weight management carried out as a multimodal approach?
I would always treat for inflammatory pain first, because inflammatory is the first driver. So the inflammatory pain, we have different types of pain. Probably quite a good website to look on if you're interested in types of pain is the International Association for the Study of Pain, IASP. They have a really good definitions page on their website, and they consider inflammatory or nociceptive pain. Yeah. They consider neuropathic pain, and they consider another type of pain called nociplastic pain, which is a pain that can be a mixture of those 2 components, but sometimes we don't always know where pain comes from, and fibromyalgia would be a perfect example of that. Inflammatory pain tends to drive neuropathic pain. We have inflammatory pain and we have neuropathic pain in arthritis. There's really good evidence for that in people, and there's evidence for that in dogs as well. But inflammatory pain tends to be the driver to that. One example of that would be most cases of arthritis, we're talking about inflammatory pain. In the joint, you've got the bone, and then you've got the cartilage covering the bone. Cartilage doesn't normally have nerves within it, but when the cartilage becomes damaged, nerves grow into it. So then those nerves start sensing that pain. That's an example of neuropathic pain as associated with the arthritis. So the inflammatory pain was there first. That and the structure of the cartilage caused the damage and the inflammation, then you get a neuropathic pain on top of that. So I would always treat inflammatory pain first.
Yeah. Let's have a look what other questions we've got. We've got Anne, who says her 6-year-old lab cross has DJG in her elbows. She's currently on Galakrond, which has improved her mobility to a certain extent. On bad days, I will give half a paracetamol. How often is that okay to give?
I would do that long term and see if you can reduce those bad days to 0. Yeah. Paracetamol, we do have some evidence. We take a lot of our chronic use of paracetamol from the human literature that we tend to see better pain control when we add paracetamol to non-steroidals. Yeah. Longer term, we would, with any combination of drugs, any multimodal approach, we would always advise as a baseline, we take a blood sample, check liver and kidneys are absolutely fine, and monitor that every 6 months. I do that quite a lot and I don't get terribly excited. I think the changes that we do see are associated with normal aging changes. So don't be scared by the idea that I'm suggesting that we do blood samples and monitor. It's more that we have quite a tight safety net, if you like. We're very interested in making sure that we're not doing any harm. Yeah. I would try, what I would do is prescribe paracetamol for a month alongside Galliprant and count the number of bad days. So keep a pain diary, record the number of bad days. Half of paracetamol very difficult. I'd go back to your vet and specifically ask about the dose there. On my website, on Zero Pain Philosophy, as I said before, it's an educational site directed at vets and nurses. There are pain updates there on Galliprant, and there are pain updates there on paracetamol. So, that it's directed at vets. If you want all your owner-directed information, you head to CAM.
Yeah, and in this case, it's probably, I don't know what you're already doing for your dog, but maybe getting a physio or acupuncture or hydro or whatever the case may be. And you may find that you need to give paracetamol consistently for a little while those take effect, while you build up some more muscle and strength, and then you may be able to wean off. So that might be another route as well.
Everything else, talk to therapist about exercise management.
Yeah, definitely.
I have an incredibly good relationship with my 3 physiotherapists, and they deal with all the instructions as far as exercise management for the clients are concerned.
Yeah. Lauren says, have you got any experience with Galliprant with inflammatory bowel disease dogs, or positive or negative experiences who can't cope with traditional non-steroidals? Sorry, I've lost it. There we go. And the trial of Galliprant he's had, he then had an acute pancreatitis bout. Is it a coincidence? It's a vet nurse with a screwed up Labrador mix.
I have used Galliprant in dogs with inflammatory bowel disease. I think what we've got to do is just be really cautious, because I think inflammatory bowel disease is probably maybe a slightly narrower field of disease compared to arthritis as far as severity goes. Actually, interestingly, there is a link between IBD or IBS in people and musculoskeletal pain. So getting the inflammatory bowel disease under control, although we don't honestly know this in dogs at the moment, and I need to think about how to design a study around this. We see plenty of Labradors with IBD. I think it's really important the IBD is as well controlled as possible, because there is a link as far as central sensitization goes with those two. I think you've got to be really cautious about any type of drug. I think the safest thing to say is any drug could upset the balance. If you've got inflammatory bowel disease and that's enough to trigger pancreatitis, so I mean that's just general inflammation, irritation in that area, the IBD has got to be fairly severe to upset the pancreas, and we don't like to upset pancreases because they just go into meltdown. I would just be cautious with any type of drug in that situation. I have got amazing experience with acupuncture in dogs with inflammatory bowel disease. So if you're really worried about drugs, go for some acupuncture.
I agree. Being an acupuncturist. I think also an interesting point, which I've not really thought about, I have got a couple of IBD dogs who are on Galliprant and doing okay, but I would say they're not on the severe end of the spectrum. But I do wonder as well, because it's liver, I think it is liver flavoured, whether who are very food sensitive may have reactions to that as well. So again, it's very much trial and error, unfortunately. Sometimes you don't know until you've tried, and then you may have a poorly dog. So it is always weighing up the pros and cons, isn't it, with these things?
I mean, I would always hate to be in the situation where an owner phones me on a Monday morning and says their dog spent the weekend in the out-of-hours centre. So I think that's kind of a worst nightmare situation for me as far as prescribing goes.
Yeah. Just going to read through.
We're not going to prescribe that on a Friday afternoon and just let you go off for the weekend, by the way. Everyone rushes to the vet on Monday morning.
Yeah, absolutely. Lots of people are agreeing. We've got somebody who's saying how much they love you. People are agreeing that Galliprant and it's gone well. Julia is saying her girl has kidney and liver problems, but she was on Metacam originally and then changed to Onsia, which made her kidneys worse. So on Galliprant now with Tramadol, and it seems to work really well.
Okay, good.
Let's have a little look. Somebody's asking about, would Galliprant be the safer option or the preferred option for dogs with kidney disease? And we kind of discussed that, but I don't know if you want to comment on that.
Yeah, I think we just got to be cautious because we don't have a massive body of evidence with using Galliprant in kidney disease. There was a study, we don't really have much work in dogs. There's a study in cats. The quality of the evidence was moderate, let's say.
Yeah.
But what they showed was that when they used a non-steroidal in cats with arthritis, their kidney disease actually got a little bit better. Probably those cats were moving around more, they were drinking more, and so that was better for their kidneys. Personally, this is a totally individual decision. This is where you need that relationship with your vet, because, okay, you might have a 6-year-old arthritic Labrador at the moment, but when you have a 13-year-old Labrador and they do develop kidney disease, you need to be able to have an honest conversation and say, well, actually, this is what I want to do.
Yeah.
What would I think fair out the drug that provides the best quality of life for as long as I have my pet for? I'm probably not going to aim for a 20-year-old Labrador. I'm going to aim for a 13-and-a-half-year-old Labrador that's had a really good life. So that is totally individual, and we will all feel very differently about that.
Yeah.
But if you've built that really good relationship with your vet, by the time you get to that point, they are going to know exactly what you're going to say before it even happens. So
Yeah, you're absolutely right there. Claire's asked an interesting question. Her German Shepherd is 3 and on Metacam. I've read lower down that it's due to hip dysplasia. Should she be giving probiotics? He's got worse since the hydro stopped, which I assume is because of the coronavirus.
That's a shame. I don't think there's no good evidence out there about probiotics, or the other drug that we often think about is omeprazole, or any of the kind of gut drugs. I was part of a panel. It was actually back in 2012, and we looked at the evidence, and there wasn't any evidence that we should be doing any of these things. I'm not saying that it may be beneficial for an individual patient, but as far as we know, we don't know using probiotics or any gut drugs alongside non-steroidals has any beneficial effects. What I would say is if he's getting Metacam and he's improving, he doesn't have any adverse effects, then I'd be really happy with that. The most important thing right now is monitoring him for deterioration. I'm not sure when you're going to be able to start hydro again. It would probably be worth saying to your vet, I need something else. At the moment, I think he probably needs another type of pain medication alongside the Metacam to keep him comfortable.
Yeah. We'll take a couple more questions if that's okay with you.
Yeah.
Ingrid said her vet has decided regular blood tests are not a good use of limited funds, so has never done any tests. What's your thoughts on that?
Like I say, if you ask me what best practice is, for me, it would be a blood test every 6 months, but I have looked at a lot of blood tests every 6 months and not got terribly excited. But I give you my advice and you choose to take my advice or you choose not to take my advice. Yeah. So that is how you spend your money is entirely up to you. Yeah.
And I think at the end of the day, we need dogs to be comfortable. So your vet's probably in this instance prioritise the payment for pain relief.
I mean, I think the owners have to make that. You have to make that decision for yourself. Your vet should be presenting the options to you and working with you to make those decisions. We're back at relationship building, aren't we? Yeah,
it's very important in everything we do, and I think you sort of talked about it earlier in that. I like to talk, I mean, I'm a big talker anyway, but I like to talk out loud and bore my clients to death about work. And I think the more you are knowledgeable yourself about what you're giving to your own pet, the more you can be empowered to say to your vet, well, I'm only on twice a day paracetamol. I actually think we're dipping in the middle of the day, so do we need 3 times a day? Having that conversation, because the vet only sees you however often. Even my patients I see regularly, I might only see every couple of weeks, and there's so much that happens in that time. So I think having that communication is really good.
The most important thing I find is, okay, I love seeing the pets, but it's hearing the owner's feedback. And actually right now, from a pain management point of view, that can easily be done over the phone. We don't need to see your dog to prod and poke them. If you're worried about your pet right now, you can get a teleconsultation with your vet. So please, if vet practices are open, if you think your pet is in pain, you should phone your vet and get a teleconsultation, and they can do some remote prescribing for you.
Absolutely. There's 2 more questions. I'm just going to quickly summarise I think are useful. One is, can Galaprant be used long term? That's from Paula, who's got a 10-year-old Bernese Mountain Dog. And the other question is, would galliprant be used post-surgically? And that's from Susanna.
I personally would use Galliprant long term. What I'm going to do is, if I prescribe Galliprant for a patient and it makes a difference, then I'm going to carry on prescribing that long term. We're going to monitor for adverse effects. Okay, it's a license. I said about doing blood samples for drugs that aren't licensed, but actually it makes good sense to do blood samples maybe on a yearly basis in any patient on long term medication. Post surgically. How I tend to manage those patients at the moment, let's say I've got an arthritic dog that's on grapiprant, galliprant, and it's coming in for another type of surgery. It's had the grapiprant 6 p.m. the night before. I'm going to give grapiprant 6 p.m. the night after. We still have that prostaglandin.
For a case of a dog who was having normal surgery, though, you wouldn't opt to. So let's say they had a cruciate op, for example, galliprant wouldn't be licensed, so probably, I'm assuming, wouldn't be your drug of choice in that case.
Not if the dog wasn't on galliprant already, then I would just use whichever non-steroidal that dog was already on. But if we do have those cases that are on galliprant, I'll just carry on their galliprant. The dog's gonna have in its pre-med, it's gonna have opioids, so it's gonna have really good analgesic. It's gonna have a nerve block, so it's not gonna feel anything during the surgery, and we're gonna pain score those patients afterwards and provide them with more opioid as required.
Perfect. I think we've answered pretty much all the questions now. Thank you so much, Matt, for your time.
That's all right. Cool.
I had a great time. I thoroughly enjoyed it, and I'm sure.
Yeah, I always enjoy these.
Would you like to do the 10 top tips with me?
Oh yeah, this is where I get really thrown.
Just general ones. I'll start on number 10. Okay. So my number 10 is, I think, just to reiterate everything we've talked about today. Please keep a nice open line of communication with your vet. So talk to them, let them know how it's going. Even if you get the email, and just pop over an email and say, oh, Buster's doing great this week since we started this drug. I'm really pleased so far. Just wanted to let you have a heads up, because I know myself that I get worried about patients. I don't forget when I put them on something, and then if I don't hear, I'm hoping that's because it's a good thing, but you don't always know. So it is lovely to hear and hear, and especially on the reverse flow, if things aren't going well, you want to know as soon as possible so you can help and change things. You're number 9.
Tell your vet if you see side effects. We have other options.
My number 8 would be, don't feel that you need to feed your dogs twice a day. You can feed as many times in the day as you need to. You want to. Just make sure your food amount is always the same, so you're not overfeeding them. But it's a nice little endorphin boost for them through the day, and especially at the moment where we're trapped indoors, it's a good bit of enrichment for them. Your number, I think, number 7. Yeah.
Use a pain scoring system.
And I guess you can get those from your vet if you're not sure. Yeah. My number 6 would be look at some further on from enrichment, some more toys, things that you can do at home with them, screwed up paper, all those sorts of things. There's loads of ideas on Cannes, so have a look at those. Number 5.
Consider all aspects equally, so not just drugs, everything else.
Brilliant. Multimodal management. My number 4 is, in terms of dog walking at the moment, just try and keep everything nice and consistent to what you've always done. And I know that's difficult because we can only go out once a day, but you can do lots of activities around the home instead, or in the garden. Your number 3.
Work with your physio on exercise management.
Brilliant. My number 2 is, when you've got a free hour, Go onto the CAM website and root around all our resources. There's so much on there. So please have a look. And also the other thing is, if you're not already, join Holly's Army, because it's a brilliant, supportive, kind and evidence-based forum. And you're number one.
Use non-steroidals as first line in arthritis.
Yeah, brilliant. Thanks for that. And thanks everybody for being with us tonight. See you later.
Cool. Thank you. Bye.